I'm Lisa Carroll. I'm a licensed clinical social worker. I work at San Diego Medical Center in the ICU. I also am on the executive board for NUHW, the Southern California division, and I also am the medical steward for all the medical social workers that are in the San Diego area, both inpatient and outpatient. I've also have a wonderful partner over in Care at Home. She's a new steward, and I've been mentoring her this past year just because the work is so important and shoring people up is so important. I've been with Kaiser 17 years, and I've been a steward for 15 of those years.
My name is Christian. I am a registered nurse at Kaiser. I've worked there for about 6 years. I am a union steward, and I'm also a member of the bargaining committee.
Hello, everyone, and welcome back to another episode of Working People. I'm your host, Mel Buer. Working People is a podcast about the lives, jobs, dreams, and struggles of the working class today. Brought to you in partnership with In These Times magazine and the Real News Network, produced by Jules Taylor and made possible by the support of listeners like you. Working People is a proud member of the Labor Radio Podcast Network. If you love what we do and are looking for more worker and labor-focused shows like ours, follow the link in the show notes and go check out the other great shows in our network. And please support the work we're doing here at Working People because we can't keep going without you. Share our episodes with your coworkers, friends, and family members. Leave positive reviews of the show on Spotify and Apple Podcasts, and reach out to us if you have recommendations for working folks you'd like us to talk to. And please support the work we do at The Real News by going to therealnews.com/donate, especially if you want to see more reporting from the front lines of struggle around the U.S. and across the world. On October 21st, after contract talks broke down, 2,400 behavioral health workers with Kaiser Health System in Southern California walked off the job on strike in a bid to bring their employers back to the table and negotiate a decent contract. In the first week of the strike, the union joined 2 bargaining sessions with the healthcare provider in an attempt to close the gap between proposals, while workers continued to walk the picket lines at multiple locations in Los Angeles and San Diego. Chief among their demands is for Kaiser to secure safe staffing levels and reduce appointment wait times for their patients, as well as bring parity between the Southern California workers and their Northern California counterparts in pay, retirement benefits, and scheduling. As it stands, SoCal workers are suffering under worse working conditions than their counterparts in the North. Bargaining for these gains, however, has been difficult, with the employer consistently bringing unsatisfactory proposals to the table. In a recent press release sent to the media on Monday, October 28th, the union provided an update after bargaining once again broke down with Kaiser on the 25th. Quote, contract bargaining has broken off after Kaiser Permanente negotiators on Friday once again invited workers to the table only to offer practically nothing new. While Kaiser's nearly 2,400 mental health professionals are seeking the same amount of time as their counterparts in Northern California for critical patient care responsibilities that can't be done during appointments, as well as the same pension benefits that Kaiser provides nearly all of its other California employees, Kaiser's primary new proposal in bargaining on Friday was an additional 25 cents per hour for bilingual workers, end quote. With me today to discuss the contract negotiations and the strike are Chris Reeves, a psychiatric RN with Kaiser, and Lisa Carroll, a licensed clinical social worker and medical social worker with Kaiser. Thanks for coming on the show.
Thank you for having us.
Yes, thank you for having us.
You guys have been on the picket line all day. How are you feeling after the first day on strike?
I think physically a little challenged, but I think mentally and emotionally it was in San Diego, it was really good turnout, really good energy, really good media coverage, really good political support. So I would say it was a great first day. And we even had nurses come out from UNAC and a couple clerks come out from Local 30 to walk with us, picket with us during their clocked out time. So it was a really positive first day.
Great. How about you, Chris? How was your first day?
I completely agree. It was actually very invigorating, even though I'm extremely tired. I feel fired up. I think a lot of us really just kind of fed off of each other and really just felt the energy. There was a lot of energy, a lot of passion out there. A lot of frustration that we were able to get out. But it was very inspiring to see everyone come together. We had a really awesome turnout at LAMC today, and a lot of support from the public as well. So that was really nice to see and experience.
That's really great. I think before we get too far into the weeds of the strike itself, I think it would be a really good place to start, perhaps maybe to kind of discuss the makeup of the unit. So there are 2,400 behavioral health professionals in this Southern California unit. Can you kind of speak to the types of job titles, professions, what kind of your day-to-day work looks like within the unit?
In medical social work, you'll have people that are social workers in a hospital. You'll have social workers that are in an outpatient clinic. You'll have social workers that are working with hospice, home health, palliative care. So one of the reporters today said to me, because I work in the ICU, well, what does an ICU social worker do? And I said, all the things that the doctors and nurses don't do and shouldn't be doing. I mean, they have medical things that they need to do. But if somebody's ended up in an ICU, needless to say, either they've had an acute event or they have a chronic condition that has brought them there. And so they need social, emotional, financial, legal, psychiatric, behavioral health support, as does their family, because while the medical folks are putting the person back together again with a plan for, stability, I have to do that for their life so that coincides, so that when they leave the hospital, they're able to see a pathway to supporting themselves, their families, things like that.
Yeah, so I work in the Pan City area. It's a pretty large service area, and it's made up of 2 clinics. And inside those 2 clinics, it's an outpatient behavioral health centers and addiction medicine as well, which is made up of licensed clinical social workers, marriage family therapists, psychiatric nurses, psychologists who are used in a very specific and specialized capacity, as well as I think I mentioned psychiatrists, the physicians. So it's a huge team. It's everything under the sun. We also have medical social workers as well. And so we're divided in teams. We have a team of what we call return therapists who are seeing patients. Usually, even it should be weekly or biweekly, but because of the poor access that our clinic has chronically suffered with for many, many years, most patients are only able to be seen once every 4 to 6 weeks, sometimes 8 weeks, sometimes longer by those return therapists. We also have a BIOS group who really sees the patients who are more acute. We've seen some changes to that too, because all those programs are very impacted. And so those are the providers, the social workers, therapists who are providing group services and case management for ongoing and more frequent follow-up care. For addiction medicine, there are addiction medicine counselors. Also, we do have physicians that work in that department managing the gamut of substance abuse, and obviously psychiatric and substance abuse. A lot of times they go hand in hand. Those are very complex patients. I personally work more so directly with the psychiatrist and supporting them. They have extremely large caseloads. They actually have no caps on their caseloads. And so we have pediatric and adult psychiatrists, some who also have more specialized care, such as eating disorder. And so the psychiatric nurses there really support patient messaging, specifically all of the messages that are coming in via telephone or call centers, as well as the physician emails. And so our primary role is to complete assessments, to provide education, to also do follow-up, medication follow-up, answer questions and address issues. Patients who are experiencing acute episodes, especially if they're having exacerbations of their symptoms, patients whose symptoms are not well managed on their medications, and really in the last several years, doing a lot of care management through the phone and through messaging, because a lot of our patients are on wait lists and are not able to see their providers. And so that is the bulk of our job. We do work with the interdisciplinary team, and we get messages from our therapists and social workers, and we do provide follow-up for patients who have seen their therapists who are having untreated symptoms as related to medication or side effects, things of that nature. So we also have to follow up on those things. And last, I don't think I mentioned, we do have a team of crisis therapists as well who work in the department. So we also work closely with that group as well.
So just from hearing both of you kind of describe your respective spaces in behavioral health within the Kaiser system, that's a lot. That's a lot of work to pay, to have to pay attention to. That's a lot of focus on patient care, as it should be, right? I think this is kind of a good place to sort of hone in on what's been going on in your negotiations since July. So you've been negotiating a contract since the end of July, and what you're asking for in regards to some of your proposals, especially as it relates to caseloads, as it relates to better quality of patient care without, burnout, ruining the caregiver's life, in terms of just time spent and pay for that kind of work. Can you Lisa, speak to some of those proposals and what the union is asking for?
I think one of the things that I wanted to start with is, even before bargaining, the union leadership met with the Kaiser leadership, and Kaiser initiated that meeting. And they asked us, what will it take to restore the partnership with your union? And we were very clear with the same three asks that we're consistently repeating, which is, in 2015, they unilaterally took away all of our new hires' pensions as a punitive action because we had raised the mental health access and denial and lack of care and all the suicides and everything to Sacramento. And so we had to be, I guess, taught a lesson. They refer to it as bad behavior. They think we're behaving badly again right now. The second part of that is that we're not asking for anything that any of the other labor unions don't already have. So whether it's the service and tech units or the nurses units, we're asking for the same type of wage increases that they've received. And there have been multiple periods of time where we've been given nothing, 5 years here, a year here. So over time, our wage scale has really eroded. So I know one of the things Kaiser has said in the news is that they're paying us, I think, 18% over market rate. I have no idea what numbers they're talking about, because we have to compete for the same group of people to come work for Kaiser as does Sharp, Scripps, and UCSD in San Diego. And they have all equal or exceeded Kaiser's wage scale. So either somebody's not doing their job, or I don't know how to explain that, but that's a real problem. UCSD still offers a pension. So we're not able to attract, recruit, retain people. One of the things we did in a past contract, which Chris would remember, is we set these pathways so that you could bring in people who weren't licensed, who could work on their license and earn their hours. And then hopefully that would be a way of, attracting and recruiting and retaining employees. But the workload is so horrific, and the competition is so good that they get their licenses and they leave. And they feel really badly about it because they've been a part of a team. I think the only thing that we really have going for us is sort of a lifeboat mentality. We all have been in this lifeboat together. We have all fought together. We all want to stay together, and we want to navigate this lifeboat into better waters. But I can't stand in the way of somebody choosing to leave where they're going to get better compensation and a better work life. So for myself, as an example, I cover an ICU and a step-down unit. That's roughly 40 beds. When the pediatric social worker, who also covers a telemetry unit, is off, I also cover her beds. So I'm expected to cover anywhere from 40 to 80 beds on any given day. And so that's child abuse reporting, that's APS reporting, that's finding a representative for somebody who no longer can cognitively designate a representative and getting access to their funds to pay for long-term care. That's getting people connected to dialysis centers. That's getting people connected to transplant coordinators. So, and we also do a lot of goals of care conversations in my particular area, as well as pediatrics, depending on how ill they are. And we have to be able to refer to our home care partners in home health or palliative care or hospice. Their staff has been cut in half as a savings effort for that department, which just means profit, because there's no savings. Kaiser members pay for these benefits, and then they're denied care. And they wanted, Chris will remember this from the bargaining table, they wanted the hospice people to see 5 patients a day. Well, I don't know if you're aware of how big San Diego County is, but unless they live in the same cul-de-sac, that would actually be physically impossible. And the way the regulations read is that they must be seen by a licensed clinical social worker, that there is an assessment that's required within 30 days, actually really within the first week to 10 days of service. And so those things are not happening. So that's actually Medicare fraud. And I don't know what part of being investigated they don't understand, but they're making this whole thing so very public that we will make things very public too. And it all could have been avoided. We were happy to have this conversation at the bargaining table, but the proposals, well, I wouldn't even say Kaiser has come back. They've maybe proposed 2 or 3 things that they've spent time on that are fit onto a half of a page. Not a lot of thought went into that. And those offerings are very, wouldn't you say, Chris, very 2020, 2021. I mean, they don't reflect the economy that we have in Southern California or the wages necessary to maintain housing and live in Southern California. So that's kind of what's been going on at the bargaining table. Our group, NUHW, has just done such a fantastic job working on proposals, trying to come back with counter proposals, trying to achieve agreement. And pretty much what we get from Kaiser is deny, deny, deny. We're happy. This is something they keep repeating. We're happy with the way things are. So they're happy with 3-month waits for medical appointments, 3-week waits, 6-week waits, 3-month waits in psychiatry for appointments. This is viewed, our professional group is viewed as a non-moneymaker. So it's okay that it's a factory that churns out and spits out labor people because they don't want to spend the money. And that sends a very distorted and hurtful message to Kaiser's members because they're purchasing a benefit that they are not going to receive. It's deception.
Chris, do you want to speak more about the conditions that you're seeing in Los Angeles and really about this kind of, let's hone in on this conversation about, Kaiser's members are paying for this benefit. And Kaiser itself is making access to this benefit for its membership nearly impossible, while also making the ability for the providers themselves to be able to do their jobs just as impossible. So, you would think going to the bargaining table, that they would be willing to listen to what I'm sure is quite a bit of negative feedback from their own members, as well as these proposals to try and solve these issues from its union membership in order to create a better space of care, right?
Yes.
Yeah. Yeah. So as Lisa mentioned, we prepared vigorously months before we actually were able to get bargaining dates from Kaiser. We actually tried to engage with Kaiser in bargaining in early spring because the conditions for our workers were so bad and for our employees were so egregious. And they did not give us any bargaining dates until basically the start of fall, so July 31st. And so since meeting with them, we've brought forward many proposals. And like Lisa said, it's usually met with either complete silence, rejection, not interested, or we like things the way we are. We'd like to keep the current contract language. But the thing that Kaiser is failing to recognize is the things that they're doing, it's not working. Them being fined that record $50 million fine. And I believe it was $50 million, right, Lisa? From DMHC that, hasn't changed much in the last year. And so, to be honest, things have gotten worse. I really, truly feel like that has just it started, it started things getting worse. It was already bad, but things went from bad to worse because then Kaiser was under the microscope and they started implementing all these different tools to kind of get by and manipulate the system. And so that actually put a lot of hardship on our providers because then they had to start doing a lot more documentation and doing all of these tools basically to provide protection to Kaiser, but not necessarily to improve patients' care, their access to care or the quality of care that they're receiving. And so you're right, access is impossible. They are paying for, our patients are paying for memberships and they're not able to see providers when they want to as often as they need to. Even they're not able to see the providers according to the standards their own providers have set. So the provider might say, please come back to me in 2 months or 3 months or 6 months. And you're seeing patients who are going well beyond that because there's no appointments. Right now, the clinic books appointments about 3 months out, and every Monday a new schedule opens up for the providers. It's on a week by week basis, and by Monday morning we're completely out of appointments because the patients learn that that's the day you need to call, and they're basically fighting in line trying to get that appointment. So by Monday afternoon they're all gone, which that shouldn't be the case. I mean, we're talking about all of the appointments are gone for the next 3 months. And so that's when we get messages because those clerks they don't know what to do. They don't want to tell the patient, we can't do anything for you. And so they say, oh, talk to the nurse. Maybe they can get you a sooner appointment, but we don't have any magic keys or access to appointments that just don't exist. So what happens is we end up having to assess them and really say, how sick are you? And what can we do right now to put a Band-Aid on it? I often say that, which has truly been the most difficult thing for me in my job, is putting a Band-Aid over a bullet wound. Because I realized, as important as the work that we do, it's just a very small piece. And there are just critical things within the foundation of Kaiser mental health system that is just broken and it's not working. And so as a result of that, we've seen a mass exodus of all, between all medical professionals. We're talking a lot of therapists. There have been doctors. There have been nurses, people who have come on. They're like, forget this, especially the ones who haven't been invested and trying to see things get better, or who have been here, long enough to say, you know what, things just haven't gotten better. I've been here for a long time. It's not changing. I'm out. But we've had a huge a high turnover rate, including providers who have left Southern California to go to Northern California because there are a little bit better staffing and retention tools there, including the pension that was maintained. So it's very interesting. The ability to do our jobs have gotten, significantly more difficult. One of the things that Kaiser has done to address their access is to try and take away patient management time. And they want to tell people, the public, that the clinicians are saying, oh, we want to see our patients less. But the truth is that they need that time to do their job. And we're not asking for anything different than what Kaiser gives to our colleagues, our counterparts, because that time is important to be able to call patients back and answer their messages, to address case management things, whether that's following up with family or facilities, coordinating care, filing the necessary and mandated reports, such as filing, a child protective service report or an adult protective service report. There's a lot of things that go that are. It's apart from the things that we do with the patient face to face. And so our clinicians are really having to choose, am I going to sit there and look at my patient and make eye contact and engage, or am I going to try to do both and try to get this note done because I know I don't have enough time, and we're basically being treated, like an assembly line. We're really working in these factory-like conditions where they don't have enough time to do their work. And so with the time that they're given, and they have to make those decisions. But yeah, it's pretty terrible. Our patients are waiting months to see their doctors. Sometimes after they've gotten their medication adjustment over the phone, that still doesn't get them an appointment. It gets what they needed addressed maybe in the moment, but it doesn't mean that it's going to get them a face-to-face with their provider. And so we're seeing burnout everywhere. And that's the reason why we asked Kaiser to come to the bargaining table early on, why we did a lot of preparation on proposals to help address the staffing issues, the workload issues. And then lastly, we are trying to take care of ourselves and our families. We've had 5 years basically of wage increases. We are behind everyone else. And I completely agree with Lisa. I don't know who is doing the math at Kaiser, but they need to hire someone else.
Yeah. Well, as someone who just moved from Los Angeles and who, I have a decent job, right? And, it's difficult to plan for a future when you don't know if you're going to be able to have a salary that is, comparable to the rising cost of living every year over year. I don't know, man, as kind of a lay person, my mom is in healthcare. And so there's all throughout my life, there have been these sort of at-home conversations about, you take care of the workers and the patient care gets better all the time. Right.
Yeah.
And it just seems to me as a sort of lay person that this is a logical solution to a serious problem. And we've seen this problem explode in the age of COVID and what the pandemic did to an already stressed out healthcare system, and especially to the sort of explosion in mental health crises that was accompanied by extreme isolation and these crises, both within the workforce at these hospitals and outside of it. It just seems logical to me that if you want to solve this problem, you would do whatever you could to retain good staff to solve this problem. It just
Absolutely.
doesn't, and
Absolutely.
I think I'm sure, and let's talk about this a little bit, but I'm sure that you've had these conversations with folks who are interested in coming to talk to you at the picket line and perhaps before, and any sort of messaging campaigns that you've done about these negotiations. Are you kind of getting that same sense that you're coming from a rational position from these folks who are outside of the union, who are supporting you on the picket line?
Absolutely. I mean, every single media person that I've talked to, every single political party, union party, every single person is like, yeah, we don't believe Kaiser. We know that they have abundant resources, that they've made significant profits, and that they're making a choice not to support their workers. We did the math today when we were on the line that what they're paying a scab to come in, one person to come in and do one of our jobs would pay for 6 people to have the pension. That's a clear choice.
It's always it's always a power move, isn't it? Right? It's because when it comes down to it, they can plead poverty all the time. And I hear this on picket lines all over the place, that these giant corporations, from Kellogg's to John Deere, from the studios who were throwing writers under the bus last summer and the summer before, right? Yeah. All of them are pocketing obscene profits. More money than I could ever possibly imagine to have in my life, ever, right? In order to do what? So that they can continue to be the bosses, really, and not cede any power in the workplace, even though consistently across the board, Chris, as I'm sure you know, the workers are the ones who understand the job most intimately and also understand how to fix the problems at the job, not someone sitting in an administrative boardroom at the top of the hospital choosing who to fire. You know what I mean?
So at the bargaining table, we gave them a calculation on how to plan for how much time a person needs to do these other activities that aren't the immediate face-to-face therapy session. It was a simple math formula. I mean, I'm not a mathematician. I could understand it. And here you have a table full of people going, I don't understand. And we're looking at them going, how do you have your jobs and not understand this? So you're either lying or you really shouldn't have the job that you have, right, Chris?
Totally. And honestly, I really have taken it as, I think they're feigning ignorance. I honestly think that they're playing games. Because it absolutely makes no sense whatsoever. And I think that it's really important for people to realize really what the numbers are, because the math ain't mathin'. It really isn't. Kaiser is the Goliath of healthcare organizations. They have abundant resources and they have to fix the issues. And we have given them so many proposals and really have painted a very clear picture of what's happening within their mental health care system. And it really begs the question of, do you really care? And to me, it's very clear that they don't. It's very clear that they prioritize everything else over mental health care for their patients and their members. But they're not lacking in resources. We did the math for them that it would literally cost them about $2,000 to restore the pension for about 1,700 members who don't have it, so that we can be like the 96% of Kaiser members who do have it. But I think at this point, it's really begging the question, do you actually care about your employees? And I think that, Mel, you made a great point, because we did really see a significant demand in mental health care and addiction medicine services with the pandemic. It was very interesting because, of course, there was a critical short staffing in the hospitals, right? So we did need providers to take care of those patients who were coming in medically ill. And so at one point they were trying to pull the few of us that were working in psychiatry, the nurses, to put us in the hospital, which was fine. A lot of us were willing to go if they did the training, but it was like, who's going to take care of our patients? Because at the end of the day, we saw our first patient before any of these hospitals saw their first patient, because people were getting anxious and they were fearful. And so our demand and our volume had already started increasing before that virus had really reached even our shores, if you will. And so since then, it's just kind of skyrocketed. People have not only, because of the isolation and the different things that happen socially, but they had time on their hands, and social media, I think, also has been a big influence. And so the things that we were hearing People calling in and saying, I want to get evaluated for anxiety and depression and all these disorders because they heard it on social media. We knew something was happening. We felt the shift. I always go to management and say, hey, something's happening here. We're getting a lot of calls. We let them know our patients are much sicker. We're having a lot of patients who are struggling with addiction. A lot of people started drinking and using substances during the pandemic to cope, and they just didn't listen. We warned them because a lot of times we're getting those calls first. We're already seeing it. We have a lot of patients who are learning about ADHD, autism, things like that from social media. We started seeing an uptick. ADHD evaluation started taking a huge portion of our access. So we absolutely do tell Kaiser about these things very early on. Do they listen? No. Do they prepare for it? No. Do they plan properly or have any insight? No. Things are always rolled out in our department without proper planning, things that just make absolutely no sense for the workers or for the patients. It's egregious. I don't understand it. I don't understand how such a huge organization has such major problems and how things move very slowly. It's very interesting.
Well, everyone's a number instead of a person, instead of a human being. Right? From the patients to the workers who are taking care of the patients, everyone is a number, and that number brings in a certain amount of profit. And if you can't bring in that profit, then you're a number that gets shoved off the end of the Excel spreadsheet, which is just a horrendous way to look at healthcare in this country. And, we could have a long conversation. Maybe we'll have you back on it with the other healthcare providers that I talk to and just have a long conversation about broadly what this type of system has done to reducing humanity in this country and into these sort of like unique, not unique, little boxes, check boxes for how much money they can get out of us on an individual basis without actually providing anything in return.
Absolutely.
And I don't mean to be so cynical about it, but it is something where, I benefit greatly from mental health services myself. And I did during the pandemic and will continue to do. And I did before the pandemic. And I understand how important and crucial this work is. If I didn't have it, then I wouldn't feel like I could land on my feet after 2021, and I know many, many people in my life, just from individuals that I talk to all over the country on picket lines or elsewhere, that also benefit from these services. It's a no fucking brainer to fund them, and what that means is if you can fund the workload, frankly, pay the employees a competitive wage, increase the staffing levels, allowing for individuals to feel comfortable in a career where they don't need to give in to these high turnover rates, then you're going to see more patients, offer more services, make more money. If that is what you're concerned about as an administrator, is getting butts in seats and people coming through the doors and all of that nonsense, right? It just, to everyone but them, it makes perfect sense to listen to you at the bargaining table and find a way to solve these problems. But as we know, and again, I don't mean to sound so cynical, but as we know about Kaiser, they don't listen to their workers, and they always end up pushing their workers out on strike, to the detriment of everyone involved, which sucks. Mm-hmm. So I think maybe a good way to sort of end this conversation before we get to the what can my audience do to support you is, what is Kaiser's kind of response to the strike? Are they beyond just the full-blown PR machine that always comes out of the corporation when you walk out? Have you received any sort of indication in bargaining or otherwise that they're hearing you and that they want to solve this sooner? Or is it just they shut the doors and you got to...
We'll find out on Wednesday when we go back. Over the weekend, because I'm on the executive board, there is some internal medical advocacy in Southern California, and it sounds like they're willing to make some movement on the wages and also patient management time. But I will believe it when I see it, because I feel like this is Lucy and Charlie Brown with the football, but they're still taking a hard line with the pension because of our bad behavior. That's literally what they say. And we're not asking for anything that the other unions don't have. We're just asking for equity.
Yeah. How does that not just immediately tip off some lawyers to like honest to God retaliation? Honestly.
Yeah, it's unfair labor practice.
You know, yeah. I mean, I don't know. Maybe they'll shoot themselves in the foot and give you guys an upper hand with that, because that's obscene. That's outrageous. Outrageous.
Yeah. And I think they like that tear in the fabric, if you can kind of think about that as a piece of clothing, because as long as they maintain that tear, then they can do the same thing to the other unions. They haven't, but they want to.
Yeah, they can threaten that. Look what we did to these professionals, that we can do to you, toe the line kind of thing.
Yeah.
I still think, I just feel like their response, to be honest, I've been hopeful throughout this whole thing. Even in their first talks that they wanted to work with us, but I've seen the complete opposite. And so like, Lisa said, I'll believe it when I see it. Because right now, all we've seen is them just to try to cover up what's going on, them being very deceitful, them trying to be very confident, saying, oh, we got this, patients, don't worry if your provider's out on strike. We're going to, have other, places where you can go for your care in our vast external provider network. They're calling patients and they're saying, oh, well, do you want to just wait for your provider to come back? They're doing the, documentation that they think is going to protect them. But I feel like they're doing all the things, except for actually doing what they're exactly everything except for the right thing. I think that's well said, because they can end this very quickly, but it doesn't seem like they want to. They're closing schedules for weeks out. They're telling patients about their comprehensive plan. They're buckling down, telling people that they've actually, they haven't taken any things away, and they've, offered all of these things, but they haven't addressed the issues. They haven't brought anything meaningful to the table at all whatsoever. Many days they come to bargaining with absolutely nothing. We ask them, do you have anything for us? No. It's very curt, and it's very obvious that they're not taking it seriously. But I think today, that we show them that we're a force to be reckoned with. I don't think that they anticipated the number of workers that, said enough is enough. I did want to mention too, one thing that everyone can do, because this is a huge sacrifice for everyone. And so if they want to help and support our cause, they can go to home.nuhw.org. That's the main page for our campaign website. And there is a way to donate to hardship funds. For Kaiser patients, there's a way for them to share their stories, and the link to Kaiser Don't Deny website, so they can really actually tell the public exactly what's been going on, how hard it has been to get appointments or services that they've requested or that they need. So that's a huge way for people to support and bring awareness to what's really, truly going on at Kaiser.
Lisa, is there anything else you wanted to add? Is there a strike fund for striking workers, or do you not have something?
It's all through the exact same resources that Chris just reviewed. Okay, and I always say, just call Greg Adams and tell him what you think. The more people that blow up his phone, the better. That's great.
Honestly, that would be great. Final thing, picket locations for anyone who wants to come join you on the picket line. There's one in LA, at least one in LA and one in San Diego.
Aren't those also on the website?
Yes, those will be on the website. Tomorrow we are going to be in Woodland Hills. And so we're expecting a large turnout in Woodland Hills, but that will also be every location that's going to kind of be, a day of action. It'll be listed on our website. So tomorrow will be Woodland Hills.
Okay. Is there anything else you'd like to share with our audience before we break for the night?
Oh, thank you. It was a nice conversation. I really appreciate your awareness.
Thanks.
That's my dog giving the last two raw.
Yeah. And as always, I want to thank you all for listening, and thank you for caring. We'll see you all back here next week for another episode of Working People. And if you can't wait that long, then go subscribe to our Patreon and check out the awesome bonus episodes we've got there for our patrons. And go explore all the great work that we're doing at the Real News Network, where we do grassroots journalism, lifting up the voices and stories from the front lines of struggle. Sign up for the Real News newsletter so that you can never miss a story, and help us do more work like this by going to therealnews.com/donate and becoming a supporter today. Once again, I'm Mel Buer, and with much love and solidarity, I'll see you next time.
My face you no longer see. I live on, yes, I live on. Wherever we go, we're going to roll the union on. The song I live on, yes, I live on. Wherever hungry are we. Just as hungry can be. The song I live on, yes, I live on. Where mean things are happening in this land. It's read a song I live on, yes, I live on. Wherever the book mean things are happening in this land is read, I live on, yes, I live on. Wherever the videotape of me is shown, I live on, yes, I live on. If I have help to make this a better world to live in, I'll live on, yes, I'll live on. When my body is silent and in some lonesome grave, I live on, yes, I live on. When my songs and poems are read, I live on, yes, I live on.
Thank you so much for watching the Real News Network, where we lift up the voices, stories, and struggles that you care about most. And we need your help to keep doing this work, so please tap your screen now, subscribe, and donate to the Real News Network. Solidarity forever.